Well, good morning, everyone. Welcome to our Government Affairs session, the first of 2021. So here we are, we've all made it. Happy to see you all again, and thank you for joining us this morning. You all know Cindy Murphy. She is a member of our board of directors with the Chamber and is with El Camino Hospital as Director of Government Affairs. And as Cindy and I were talking, we thought it might be really helpful and informational to share with all of you more about the El Camino Healthcare District. And so with that, I'll just turn things over to Cindy.
Thank you, Kim. So just to clarify one point, I'm the Director of Governance Services at El Camino Health. And our Director of Government and Community Relations is John Cohen, who is going to be joining our call this morning. I apologize, I have to sign off at 9:30. I got a meeting invitation from my boss, and those are hard to turn down. So I am going to start with the presentation. One of the things I was hoping that you could all share with me just by perhaps raising your hands is how many of you think you know, as we start out today, what the El Camino Healthcare District is and what its relationship to El Camino Hospital and El Camino Health is? And then I'm going to come back at the end and see if I've enlightened anyone at all. Okay. All right, thanks. All right, so the El Camino Healthcare District is a public entity. Sorry, I'm having trouble advancing the slides all of a sudden for some reason. Not sure why. I was able to advance them a little while ago. Oscar, can you help me maybe?
Try unsharing your screen and then resharing again, Cindy.
Okay. Okay, there we go. Thank you. So it's a public entity, and it was formed back in the late 1950s when healthcare services were becoming more technological, more advanced across the nation, certainly in California. And California was largely rural and agrarian at that time, with the exception of some very localized high density population areas. And these rural agrarian areas, including what is now the Silicon Valley, were without access to the local acute care hospitals. So the California legislature enacted the part of the California Health and Safety Code. And there's a lot of information on this slide, but long story short, what they said was go forth, form healthcare districts and tax the property owners and use those funds for healthcare services in your area. And that included building healthcare facilities and providing or helping to provide other healthcare services, including inpatient programs, outpatient programs, retirement programs, chemical dependency programs, and all kinds of other healthcare facilities and activities at any location inside or outside the geographic boundaries of the district for the benefit of the district and the people served by the district. So our area went forward, and in 1957 formed the El Camino Healthcare District. And the district includes all of Mountain View, all of the city of Los Altos, a portion of Los Altos Hills, and very small portions of Sunnyvale, Cupertino, and Palo Alto. The reasons for this is that a lot of the homes are currently in Los Altos Hills. Those were large ranchos at the time. There weren't single family homes in about half of Los Altos Hills then. And there were some large property owners in Sunnyvale, Cupertino, and Palo Alto that were very agricultural and did not want to be part of the healthcare district. And so we formed this district. And then in 1961, we opened the original El Camino Hospital, which you can still see on our property on Grant Road. The red brick building is still there, even though we have a brand new building that opened in 2009. And that red brick building is going to be coming down sometime within the next couple of years, part of our master campus plan. But the hospital was opened originally in 1961. And this is a slide, I wasn't able to get it updated. I've used this slide before, and this just shows you where the tax funds that we collect every year from the district residents and property owners goes. There's sort of 4 buckets. So back in fiscal year 18, which was a couple years ago, our budgeted maintenance and operation and government obligation taxes that we budgeted to collect was about $24 million, which is a very small amount of money when you think about that the hospital corporation itself is $1 billion organization. So the district collects a little over, probably now it's $27 million. As property values increase in the district, obviously those revenues go up, and property values have been increasing lately. And the district uses those funds for a couple of different things. One is to repay the government obligation bonds, which are used to build the new hospital. We have a capital appropriation fund that we allocate funds every year or two to projects, capital projects on the Mountain View campus with a value over $10 million and a life of over 10 years. So those funds can only be spent on the Mountain View campus. That's the only place we spend those. And then the district does have some operating expenses, even though it has no employees. It does incur certain consulting fees and a few other things. And then there's a capital replacement fund that we have. We own the YMCA building. And then the rest of the money, which in fiscal year 18, we had budgeted almost $9 million, was for our community benefit program, which some of you may be familiar with. We have a large community benefit grant program through the district that provides funding for nonprofits, school districts, and various programs that serve people who live, work, or go to school within the boundaries of the El Camino Healthcare District. So those are the buckets, and that's what the district does. You may wonder, I said, the district doesn't have any employees. How does the district do anything? So what we do have is we have a management services agreement between the hospital and the district. And through that agreement, the hospital provides the services of some of its employees, including me, John Cohen, our CEO, our CFO, and various other employees throughout the organization that actually perform tasks for the district, but are employed by the hospital corporation. So I hope that makes sense. And it's a very small contract, and the sort of in return, what the hospital gets for providing all those services is a lease for the land that the hospital corporation sits on. It's a very much below market value lease, and the hospital benefits from that. So it's sort of a back and forth, and it makes things a lot simpler for the district operations. So back when the district was originally formed, the district was had 5 publicly elected board members, which it still has today, and that district board governed the hospital. And in the 1980s, a new law was passed that said that these district hospitals could become 501c3 corporations, and that was to allow these hospitals to be more competitive and still provide community services to the local community, and to allow them to take advantage of the nonprofit tax laws. And so the El Camino Hospital became a 501c3 corporation, but the district still existed and still does exist. And the relationship between the two is that the district is the sole corporate member of the hospital corporation. And that allows the district to have a certain amount of control over the corporation. And that control is exerted through several provisions in the hospital's bylaws. And these, we call these the reserved powers. So here you can see sort of a chart of our governance structure from the district down through the hospital. So currently, as I said, we have 5 publicly elected district board members. We just had an election in November. Those 5 board members are John Zoglin, Julia Miller, Peter Fung, George Ting, and Carol Summersill is our newest district board member. And then the hospital corporation, since it's a separate entity, does have its own board of directors. And one of the reserved powers that the district has over the hospital is the ability to appoint the members of the corporate board, which they do. And even though they don't have to, they have historically, for many years, since the corporation was formed, and they still do today, they appoint themselves to the corporate board. So the 5 of them sit on the corporate board as well as the district board. And then we also have an additional 5 subject matter expert members on the corporate board. And that's relatively new in terms of the history of the hospital. That happened in 2012. The district board decided that things were just getting very complex and they needed some subject matter experts on their board to help them govern the hospital. And so that's what they've done. They started out with just 3, and then in 2017, they added 2 more for the total of 5 that we have now. And they also, at the same time, they expanded their committee structure. And these are all the committees that advise the board, and you can see the 6 that we have there. And the committees are very much like the board. The committees each are comprised of board members, but we also have what we call our community members of the committee, who are outside experts in these various fields that serve on our committees and help the board. And we really try to keep the work of the board at the committee level, and then bring advice from these combination of board members and community experts up to the corporate board so that we can govern in this extremely complex healthcare environment that we find ourselves in. So the voters have certain rights, right? The voters elect the district board members, and there are certain things that the board can't do without the approval of the voters. Approving certain sales or leases of the hospital. There's some district transactions that have to be approved by the voters. Bonds have to be approved. And they also have to approve temporary increases in the GAN limit, which is very complicated and beyond the scope of this presentation. And then the district, as I said, has certain retained rights. One is the sole voting member of the corporation. And then all of those things that are in the hospital bylaws that I was alluding to earlier. One is they elect the hospital board members. Any amendments to the articles of incorporation, would have to be approved by the district. The hospital bylaws can't be amended without the district's approval. Certain assets, the sale of those would have to be approved by the district. If there were to be any kind of a merger or dissolution of the corporation, the 5 district board members would have to approve that. They can remove the hospital board members, including themselves or the 5 subject matter experts, anytime they want to. That they have to approve the corporation's annual budget, which they do every year. The hospital first approves its budget, and then we have to take it to the district board for approval. The approval of the selection of the hospital's chief executive officer has to be approved by the district board. Certain capital transactions, so whenever and these tend to be very large construction projects, the district has to approve all of those. So everything not everything, the big things that happen at the hospital start at the hospital board. And then we have to take it through a second approval process to the district board for a lot of these things. And when the hospital wants to change its strategic plan, that also has to go to the district board. So it's kind of interesting where you have these 10 board members who are voting on it, and then 5 of them have to vote again at a different board meeting. And then I just wanted to sort of land on this because of the hospital's relationship to the district. Not only are our district board meetings open to the public and subject to all of the provisions of the Brown Act, our hospital board meetings are also open to the public and subject to all of the provisions of the Brown Act, as are our board committees. So we have a lot of effort that goes into planning these meetings, running these meetings, making the meetings open to the public, and of course, keeping all of our board members and all of our committee members in compliance with the Brown Act. So it requires a lot of work, and it does make things sometimes, what's the word I'm looking for, not as nimble as many other corporations are with their boards. It's, decisions have to be made in noticed meetings and open to the public, just like, city council or a school board. And many corporations are, they can call a meeting of their board with, a day's notice or a couple days notice, and you can do it over the phone, or they can vote over email. And then, if something has to be done, it can be done very quickly. And so there's a little bit of, cumbersomeness to our decision-making abilities at the hospital and the district. But that's all, weighed against, the fact that we collect taxes from our residents, and we need to be open to the public for that reason. I will just say that right now during the pandemic, things have gotten easier. Some of you may know that a number of the Brown Act's requirements have been suspended because of the pandemic. So we're able to have all of our board members can participate remotely, whereas usually we have to have a certain number of them participating from within the district. And we don't have to, right now, we don't have to provide a room for the public. We just have to provide a telephone line for the public to call in on. So that's really enabled all of us to keep our executive staff and our board members very safe, being able to participate from their offices or their homes. And during this pandemic, it's really important for all of us to stay just as safe as we can. So that's been really helpful. And we don't know when those provisions are going to change. Best guess is sometime mid to late 2021, when we'll actually be back gathering in public as we used to. So that's all I had as far as the presentation goes. I hope I didn't go too fast, and I hope that helped clarify things for folks. And I'd be happy to take any questions that y'all have.
I have a question.
Hi, Jenny.
Hi, Cindy. Is it?
Oh, it's Donna. Sorry, I thought that was Jenny speaking.
No, it's okay. So for the people who are not for the properties parcels who are not part of the hospital district, do they have an option of opting in? I didn't even realize this was a thing until a friend in the Hills signed up for the COVID testing at El Camino Hospital, and she was phoned a couple days before the test and advised she was not part of the hospital district and therefore not eligible for the free testing.
Right. No, the boundaries are the boundaries. And unless the district wanted to expand its boundaries, and there's a whole approval process, and I'm not totally clear on it, but there's a whole approval process that we would have to go through, I think, through what we call the Local Area Formation Commission to expand the boundaries. So individual property owners cannot opt in.
Okay. So the advantage to expanding the boundaries would be that the district would then be eligible to collect additional tax revenue, right?
Exactly.
Okay, thank you.
Mhm.
Yeah, Cindy, Ginny, I was wondering if you could touch a little bit about the COVID testing that you're doing as a result of allocating funds that are received through the taxpayer base, as I recall.
Sure.
Thanks.
So the district board allocated a total of $2.4 million between last fiscal year and this fiscal year to do a community COVID testing program. And what we're doing is we have a number of sites where we're doing testing. We have a site on the hospital campus, which has moved. It was in the, it may not have moved yet. It's at least in the process of moving from our outpatient lab into the Melcor Pavilion, which is right adjacent to the hospital. And then we're also doing testing through the community testing program at various school sites throughout the district, at the high school sites, at the middle school sites, at the elementary school sites. And we're doing testing in cooperation with the three chambers of commerce, the Los Altos Chamber of Commerce, which Kim has been very instrumental in getting us coordinated with business owners downtown to do testing. We have a site there with the Mountain View Chamber, and then we have also a public site in Sunnyvale where we're doing testing. And folks can sign up online through the El Camino Health website. And we do limit that to people who live, work, or go to school in the district. And we do take insurance information. And if someone's insurance covers it, then we bill their insurance. But if their insurance doesn't cover it for whatever reason, then we use the district funds. And we've been very successful in having insurance cover many people. And so the funds for the testing, we've really been able to, use those very wisely and extend the use of them quite a bit. The testing was pretty slow to start, but it's picked up a lot in the last couple of months, as you can imagine, with the holidays and the surge. So we're doing a lot of testing. I was on a call yesterday. I don't know if John Cohen has joined us yet or not, but I think what I heard yesterday was that we're doing, we've been 700 tests a week now is what we're up to, that's a lot. I mean, it takes, you have a site and you have a couple of technicians on site, and it takes a lot to get that much testing done on one site. And the school districts have particularly been very interested in getting their staff tested on a regular basis. I think we're doing testing at most of the school sites every 2 weeks or so. Not at each of the districts, and we're rotating sites throughout the districts. We've expanded it to, we're doing students at the school sites now as well. And then one thing that happened last week was the district board met, and now they're expanding that program, and we have to wait for the county because, we're very much partners with the county on this, but we're going to expand that into doing vaccinations as members of the public become eligible for the vaccine and as vaccine becomes available. We can't just go ahead and do that. We have to, I'm sure many of you have heard of the various tiers. Healthcare workers are still being vaccinated, and then it's getting rolled out to physicians' offices, dentist offices, and then various tiers below that, starting with our seniors who are over 75, and then we keep going. But we have to wait for the county to say, okay, you can use vaccine on this group of people. So anyway, we are going to be including vaccination in that program.
Hey, Cindy.
Yeah.
It's Roy Lave. You didn't say anything about hospital finances, and I assume the hospital is fully supported on income from services, and there's no public money involved. Is that correct?
So if you're talking about hospital operations in general, yes, that's absolutely correct. The district does, mentioned earlier, the district does allocate a certain amount of tax funds to capital projects on the Mountain View campus. And that's maybe, $7 to $10 million every couple of years.
Okay, got it.
Mm-hmm.
And in the vaccination program, how will that work when you get through with the healthcare workers? will there be a sign up or?
Do you want me to take that one, Cindy? or-
Yes, please, John, go.
Hi. In terms of the vaccination, there's still a lot that's being determined, and there's kind of best way to think about it is a tier system. The federal government is setting certain guidelines, and then the state Department of Public Health is setting guidelines, and they're actually meeting this afternoon. There's a community advisory committee on vaccinations, which is a public meeting anyone can watch from 3 to 6 p.m. Today, and they're gonna hopefully be finalizing tier 1B and then also starting to discuss tier 1C. And then so far, the way it's been working for everyone's information is then an allocation will be given from the federal government of how much vaccine will come to the state, and the state gives an allocation to the county, and then the county has to decide how they want to disseminate that in accordance with whatever tier is being focused on. So right now, there's still the focus on phase 1A and reaching healthcare workers, so hospital employees and affiliated outpatient locations are getting vaccinated, and then also independent doctors and dentists, skilled nursing homes, residents of nursing homes. So that's some of the current focus right now.
John, are there any other essential workers that are in that first tier? Such as individuals from the business community that are in direct contact with public, or is that a second tier?
Yeah, thanks, Kim. Good question. So some of the essential workers are in, there are some essential workers who are in 1A, like lab workers, pharmacy workers, but then more essential workers are proposed, which will hopefully be finalized today for 1B. So they're talking about including teachers, but they haven't specified yet. Will it be just teachers who are teaching in person? Will it be anyone who's a school employee? So they need to specify some of that additional level of detail. And then there also are tiers within the different phases. So there are some other essential workers like grocery workers, retail that are being discussed for phase 1B as well. And then for phase 1C, that also is being talked about other businesses, and the focus is kind of who's at more risk from interacting with the public or in a more crowded working situation.
And how do you anticipate this will be communicated to the public?
Oh, sorry, Donna, I couldn't quite hear that question.
Oh, I'm sorry. I'd like to really applaud you guys for what you did on the testing. It was very frustrating trying to get testing early on. Most people that I knew were sitting in cars for 2 hours to get testing.
Oh, wow.
Your testing program, I'm in and out in 5 minutes. It's amazing, and feels very safe. And so thank you. Big applause for that. Do you know how the vaccination tiers is going to be communicated to the public?
That's the question.
Yeah, that is a good question. In terms of the communication, the county is supposed to kind of take the point on kind of just educating people around the tiers. I think one of the reasons we haven't seen as much communication is because the state still hasn't finalized the additional tiers yet. And so hopefully with phase 1B supposedly being finalized today, hopefully we'll start to see some additional communication. But right now, the county is kind of doing targeted communications to the groups that are within 1A. So for instance, independent doctors, independent dentists, and trying to let them know, here's where you can get a vaccine at either a county facility. And then the county is also talking to El Camino Health and other health systems about just how we can fit in additional dentists and doctors to help as well. So right now, a lot of the communication is kind of in that targeted way to reach those very small groups before it gets wider in terms of dissemination.
Just a suggestion, but County Supervisor Joe Simidian has a pretty good platform, and he's been very, very proactive on communicating with his constituents concerning Corona. So I'm sure you're already there.
He's great, but thank you for mentioning that. Yeah, and we, our CEO, Dan Woods, had a conversation with him, and Dan kind of reiterated our interest in partnering around vaccinations, and actually talking to his staff later today. So yeah, definitely, he's a great partner. He's done a very good job about keeping everyone informed, and also he's just a great advocate for the 5th District in terms of helping to make sure that when we want to try to help do something in the 5th District, that he kind of helps the county focus on the 5th District too, because sometimes they need a push in that direction.
I ask a question too. Thank you both, Cindy and John, for this. So you mentioned dentists. We've had some question from those optometrists who wonder if they're left out. I mean, can healthcare providers, whether they're eyes or teeth, self-identify? Are they on the list would optometrists be on the list to get the vaccine?
Yeah, that's a good question. They're on phase 1A. The county is kind of trying to work kind of down their phase 1A. So right now, what I've heard them say is they're trying to reach the other independent physicians and their staff and dentists and their staff, just because there's kind of more bodily fluid risk from, if you think about those medical practitioners. But I know that optometrists are clearly specified in 1A. And then also the county has said that, has reiterated that that's on their list. They're just kind of working their way down. So they haven't gone there yet.
How about audiologists?
Yeah, that's a good question. I mean, I haven't seen that specifically called out in phase 1A, but
How would we find out about that?
yeah, that is a good question in terms of, I mean, it probably would have to be, well, I guess it would depend on what you're trying to find out. So if you're trying to find out if they're listed somewhere, I mean, the definitive resource at this point in time is whatever the state has shared, and I'm happy to share the link for where this community vaccinations.
Okay, that'd be great. Thank you.
Yeah, I mean, that's really the best document. And then I would say below that, the county is really, the best way to think about what the county is doing is they're trying to execute that. So they're trying to get to those different groups, but they're not really the ones who are defining this is who's included, this is not included as much.
So I have to sign off, everyone. I'll leave you in John's hands. I'm sure he can answer most, if not all, of the rest of your questions. Thank you for your time. Please don't let my departure end the meeting. So thanks, everyone.
Thanks, Cindy.
Thank you very
Thank
much.
you.
Thanks.
Hey, John, Joe Maletti here. I'm sorry to put you on the spot for, I mean, everybody's got, I'm sure, a million questions.
Oh, no, that's fine. That's part of my job. So I'm happy to help. There's a lot.
That's a pressing thing for the world. And I know it's a tough thing that we're all trying to learn as much as we can. And I think hopefully at the end of the day, we learn what works and what doesn't work in every step of the way here for any potential need down the road. So I'm trying to look for some positives in all of this. Just a question for you, maybe you may not know the answer, but is there anything, and I know the state's allocated certain number of the vaccines and then that's getting distributed and you guys receive it and obviously vaccinate everybody. And I know seems like there's a bit of we need more and more of the vaccines to be distributed, but it seems like even the amount that we initially got, it's a little, I don't want to say the word slow to get out, but I'm assuming there's some hiccups in there. And I don't know if there's anything that is something that we should either be aware of or kind of what are those hiccups if that is the case, and maybe it's just part of the learning process, but and is there ways for us or anybody to help streamline that so it does get out quicker? That's my general question.
Yeah, thanks. That's a good question. I mean, my perception is that, I mean, I think there's a good amount of hiccups in all parts of the process, which we kind of saw with the testing as well earlier on in terms of this is a very complicated logistical process. The federal government is going through a learning process with the state is, the county is, and then, you know, when it gets to a health system like ours as well, too. So for instance, we have been vaccinating our employees and just taking us as a microcosm. We went through just learning, okay, this works, this doesn't work. I would say the thing that it's probably the biggest challenge at this point is just not knowing kind of how much vaccine is going to be allocated to our county, because that kind of happens on a per week basis. And so then the county won't know until a few days before, you know, what their allocation is, and then they have to allocate it to others within the county. So hopefully our country will get to a point where there's more lead time, because that will help everyone with better planning and execution.
Okay, interesting. Yeah, so it sounds like everybody's kind of sitting, they're waiting for that allocation, and I didn't realize it comes weekly versus it seems like you'd get the, you know, the as the stuff's rolled out. But anyway, interesting. Thank you.
Yeah, you're welcome. Yeah, and just I guess for everyone else's knowledge, so for the most part, providers like El Camino Health or Stanford, we get our allocation from the county. But then for larger systems that span 3 or more counties, they're called multi-county entities. So like a Kaiser or a Sutter, PAM, they get their allocation directly from the state. But there's still that challenge I was mentioning, where the federal government tells the state only a few days in advance what their allocation is, and then, you know, they're able to tell the counties what their allocation is. So hopefully that there'll be more lead times for that, just to help everyone planning.
Follow-up question on that it's a little particular and precise, but it's been something that's been on my mind as I've watched the news lately. Because this is a 2-dose vaccine, when you receive an allocation, if I'm approved, do you have the second dose already in your hands as well that's in storage, or is that phased out? So I guess what I'm wondering is, as we're administering the first dose, is that second dose guaranteed somewhere, or is that still possibly in the supply chain waiting for delivery?
Yeah, that's a great question. And I'll just add the caveat that this is how it's been working so far, because it's a pretty fluid situation. But currently the federal government has been holding back the second dose. And then so for our first vaccinations that we did, those were with the Pfizer vaccine. And so then we just got a delivery this week of the second doses of that were held back. And so then for those employees who were the most at risk, frontline clinical workers who kind of got the first 975 doses that we administered here on site, they sent us the vaccine for that this week. So that's kind of how it's working.
I thought, which could be problematic, I would think. I don't know, it just seems, I know it's all very complicated. So,
yeah, and I think part of it is
for all
just
your
because
efforts, John.
Oh yeah, you're welcome. And I guess just my perspective on that, I think, is also just because there are these 2 earlier vaccines, Pfizer and Moderna, they have more complicated storage requirements. And so that's probably the main reason that the federal government is taking that approach, just because you know, it can only be stored under certain conditions for so much amount of time. And so, you know, it probably makes sense for that reason. So, particularly with the Pfizer vaccine, that has to be stored in an ultra low temperature freezer, as I'm sure some of you have read about, and those are something that's in short supply too. So it's probably easier for everyone not to send that out before it's needed.
And John, I'll just add, when it comes to all the stuff that you're getting the information on, you're not alone in the process. Obviously, all healthcare is dealing with this, but I work for a bank, and so we're all trying to guess what this new round of PPP funds are. So there's a lot of, you know, clients are calling and asking questions. So everybody's getting the same kind of trickles of information and trying to be in front of it. So it's making it difficult for everybody. And, you know, being whatever 9 months into this, I know everybody's kind of fatigued on the whole subject, but I, like I said, I try to be somewhat positive and optimistic that this is going and being distributed. And I know the next question, not from me, but just in general, I'm sure you're going to be facing is each round of who gets the vaccine next, and that's another challenge. And I think it'll be interesting to see how that plays out. And I think the masses, for the most part, from my perspective, the masses aren't as polarized as the news reads about it. But I think that everybody's got a rational, especially around here, have a pretty rational understanding of, I can wait another week or two or a month or whatever it is. There's some light at the end of the tunnel, and that does give hope. And for those that are in definite need of facing the public, obviously the healthcare workers and first responders and all of that, and even the essential workers that are out there. I think those of us that have the benefit of an engineering job or a banker's job or business kind of a thing where we have been able to work remote, where I think we're all kind of tired of working remote, but it's not as essential. So I think there's a rational mindset out there from my understanding. So
thanks, Joe. Well said. I appreciate that.
Yeah, hang in there.
Thanks. You too. And it's challenging for all of us now. So.
Are there other questions for John? I guess one thing that comes to mind for me, John, is just the challenges of, we have the day-to-day operations, and then you have all of these new challenges that have come due to COVID, and, what kind of impact, I guess, that has had on the hospital, the healthcare district, and whatnot, whether it's, just prioritization or financial challenges.
Yeah, thanks, Kim. That's a good question. Let's see, so many areas I could go with that one. I guess just a few things for people to be aware for context is, one, hospitals have learned a lot, whether it's El Camino or Stanford, in terms of just how to care for COVID patients. So that's certainly a positive now as opposed to earlier in the pandemic. And I would say there's a challenge now of just the volume of the cases throughout our state and also in our region. In our portion of the county, thankfully it's not as high as in other portions of the county, but there's really been an unprecedented level of coordination between all of the systems in the county. We're almost operating like a virtual health system, which is pretty amazing to see. So all the hospitals are having daily calls, multiple daily calls actually, with the chief nursing officers and the chief operating officers, and really looking at, how many patients are at one hospital versus another. How do we equalize that load across the county to preserve equity and access, and really make sure that when people need a hospital, we're trying to create as much space as possible. Some other challenges that you may have read about or heard about in the press as well is just staffing is certainly an ongoing challenge in terms of there's a surge in demand all over the country, although California is certainly one of the hot spots. But earlier in the pandemic, nurses could be moved from one part of the country who traveled to work in another part, but now hospitals are busy pretty much everywhere. So there's that constraint. And that constraint is even something that shows up in terms of vaccinations too, and that because hospital staff is incredibly busy caring for COVID patients and non-COVID patients, it makes it a challenge then to have people who could administer vaccines, who might be able to administer vaccines in other times too. In terms of the finances, when you think about finances of a healthcare institution, a lot of it is labor and also supplies. And so labor certainly is a challenge and a higher cost with the additional demand that's going on now. and then supplies, because there are shortages of so many supplies around the country. We've been able to, we have adequate supplies and personal protection equipment, but it's gotten more expensive over time. So something that's even small, like a glove that's used in a medical setting, just the price has gone up on that just because there's more demand for that. So that has led to additional financial pressures.
John, on that note, I heard, I don't know too much about it, but I heard that there may be an agreement with CVS on helping to distribute the vaccine. Will that help alleviate the strain for you guys?
Yeah, thanks. That's a good question, Joe. I think it will help with just kind of the all hands on deck in terms of just there are going to need to be a number of different partners and channels for administering the vaccine. I think it's probably going to have to include the pharmacies, hospitals and clinics, people going to their healthcare provider, also probably some community sites where people can just kind of go and get a vaccine too when they're in their tier. So I think all of it is important. But yes, certainly being able to use staff that is in kind of what we call the outpatient setting is certainly a positive versus and really trying to have hospital staff focus on what only hospital staff can do too.
I thought that was a great idea in alleviating the strain on nurses and doctors that are being pulled all around, and just administering a vaccine is not, it's a relatively simple process, but to get that out to as many quickly. So I thought that was a great partnership, and I just like the businesses have adapted to take out food and dining outdoors and trying to figure out how to get everything done. I'm fascinated and impressed by how the healthcare and everybody else is trying to improvise as best they can to get this thing out. So anyway, I think they're all great ideas.
Thanks, agreed.
Other questions for John? Inquiring minds, Sally Meadows or Roy Lave, anyone else have anything else?
Well, actually, I would love to get a little more background on, my organization is a recipient of one of your grants, and we so appreciate that. And I know that our numbers have been really affected by COVID and so forth. I would love to get just a little bit of background on your grant program and how that started and how you're dealing with the lower metrics and so forth that the recipients many are reporting, and how that'll affect future grants and so forth.
Oh, okay, thanks.
And thank you. It has really helped us stay afloat during this time.
Oh, thank you. That's good to hear. Thanks for letting me know that. And thanks, Diana and Sally. Just saw a couple comments. So I'm just going to give the caveat in that not an area that I focus on. Barbara Avery at our organization kind of oversees our community benefit grants, and I'm sure and work with her. But I just know in general, I mean, she has a very, she is very conscious about, the number one, trying to figure out how to support grantees during this challenging time. And number two, I've always found her to be a very flexible person. So I wouldn't doubt that same spirit is showing up in terms of just as you're kind of engaged in dialogue with her. So my advice would just be to just kind of stay in communication with her and her staff, and I would think probably that would be sufficient. And if you're having trouble, they've always been very responsive in my interactions with them, but if you're having trouble getting an answer, I'm happy to certainly try to.
No, they've been great. I just wondered if there was any overall, but yeah, that whole team is fantastic. So.
Oh, okay, great. Yeah, and I know that they moved quickly to try to allocate as much, or to try to have some emergency support as much as they could, even at the end of their fiscal year related to COVID. And I know that she's always very interested in hearing if there are new challenges or things, and if there's something that relates to an existing program. I mean, I would think they would be interested in hearing about how they could help out. In terms of and then as you know, they have kind of their annual cycle where people typically apply, usually in the January timeframe, for kind of the annual grants. And then they have some discretion for existing grantees who are awarded a grant if there's some unique need that pops up in the middle of the year too. So,
Great, thank you.
sure.
Any other questions, Joe? Maybe we'll go ahead and I'll make some announcements and wrap things up. My internet connection is not as stable as it should be this morning, so I apologize if I freeze up or if you have difficulty hearing me. I did just want to, that was mentioned that we've been doing in downtown Los Altos has been done in cooperation with the Los Altos Village Association, El Camino Health, and the Chamber. I feel that's been a great benefit to our business community and to our residents as well. And so really thank you, John, for all of the effort to, to bring the testing out to our community, to make it more convenient for our businesses to engage and to be able to just, quickly pop over for a test as a part of their daily schedule. And so I really appreciate the effort and support in that. So thank you.
Oh, thank you. Yeah, it's been a great partnership, and thank you for all that you in turn have done to really help get the word out, because of all the chamber pop-ups, the Los Altos one is the most successful in terms of always filling up the fastest. So, so that's just a great sign that number one, it's needed, but number two, that the word is getting out effectively. So thanks.
Then let's see, next on my list, we have been working again with LAVA and the city of Los Altos to put together what will be a restaurant week to go to promote our restaurants and support them during this time, especially now that the outdoor dining has been closed due to COVID restrictions. And so the dates for that will be January 15th through the 24th. So you'll start to see information in social media, in the Los Altos Town Crier, whatnot, about promotions. Each restaurant will have a variety of different specials that they will be offering during that time period. There'll be 2 weekends. The January 15th is a Friday. So that week bookends with weekends on each end. And so just really ask you to, support our restaurants and help them through this time. To be honest, when we were scheduling this, I've had, discussions with restaurants, and, we have some that are really struggling. This has gone on now for 9 months. And, while I feel we're getting closer, to being able to come out the other end, there's still quite a ways to go. And with all the restrictions, it's incredibly difficult for our restaurants. So ask you to please support them as much as you can during this time. So thank you for that. And then I wanted to mention that for our government affairs meeting in February, I'm talking with Mark Berman's office to schedule that. We may need to adjust the timing slightly, so just kind of be on the lookout for any adjustments in schedule, and we'll be getting that out to you, of course, by email alert and information on our website as well. But that's in the works. So are there any other announcements that anyone would like to share before we close?
Kim, I just posted the link. I'll email it to you also in
Okay.
case you want to send it out. But for that community vaccine advisory committee that I mentioned, but I put that in the chat too.
I know we also have testing at the downtown site that's open now for signups. That's the 15th of January. So we can mention that if you want to go, you know, to the El Camino website, you can register for COVID testing on the 15th. I don't know if there are any other announcements. Grants program that's open now through the state of California. Those grants are between $5,000 and $25,000. So we have been in contact with all of our small businesses to make sure that they're applying for those grant monies that are available. So if you need any information on that, please don't hesitate to.
Did we lose you, Kim?
Yeah, there she is. You're on mute though. There you go.
I did. I didn't quite make it to the end. If there are no other announcements, then I'm joining us this morning. I think this was really informational. And appreciate your joining us, John, and please thanks Cindy again.
Oh, thanks. Will do, Kim. Would it be okay if I thanked Kathy for a quick minute from the Los Altos Community Foundation?
All right, thank you.
Yeah, thank you.
Oh, yeah, I just wanted to
Great
thank
working with you.
Yeah, I want to thank the Community Foundation for all that they're doing to support our community, and also they just did a nice effort recently to just kind of help recognize the healthcare workers who are more than 9 months in, just kind of taking care of patients, and so that was really appreciated by all our staff. So thank you so much for that.
Great. Thank you.
All right.
Sure.
I think we lost Kim again. So
Thanks everyone. Nice chatting with you. Happy New Year.
Yeah.
Please don't ever hesitate to reach out if you want to chat further.
Yep.
Great. Thanks, John.
Thanks.
For your time as well. Appreciate it.
Okay, thanks. Take care. Bye.
Bye-bye.